equity investment in healthcare. So what do you tell your peers about, the $1 trillion that's being pumped into the investment in healthcare?
Yeah, I guess the thing I'd focus on is that, we're out here in California, and there are a lot of other parts of the countries that are really have some really innovative and incubator kind of startup ventures that go on. Is that, this continued investment in healthcare, and you have all these smart people trying to see how they can make a difference, whether it's through some kind of technology, through some kind of analytics. And I think what I've seen over the last couple of years is that it's really started to drive me as a CIO and even my vendor partners to say, how can we work with these people better? They've got a lot of ideas. We can't solve all the problems. The Epics, the Cerners of the world, they can't do everything. So I think it's finally driving us to say, let's open up our kind of our platforms, and let's look at how we can innovate on the edges. And so I think that's my advice to CIOs is, we've got to figure a way to really help these folks help us. And, we all get inundated every day with phone calls and people that, come want to do some things. And I think, if we can find a way to more effectively embrace what's going on and say, a lot of this stuff is not going to make it. But if we can help figure out how to get the data available, how to let them try to drive some innovation and work with our partners to say, let's open up the data, because the biggest challenge is always, how do I get them the data, and then how do I build this back into the workflow? And I think it's really forcing the industry to kind of respond.
Yeah, and Ken, I'm not sure I could say it any better. I would just close, private equity, $1 trillion coming into the healthcare market. If I were your CEO talking to the CIO, I would say, what is our plan to have some of that money work for us as a system?
Yeah.
I think that's, you really nailed that one.